What's up, guys? Derek, moreplatesmoredates.com. I am the co-founder of Marek Health, and I'm here today with Steven Granzella, our director of marketing at Marek Health, to discuss hair loss prevention, treatments, side effect management, and if you are a good or bad candidate for therapy and what you need to know.
So at Marek Health, we have a hair loss panel. What exactly does that mean, and why is that necessary compared to a normal lab panel?
It was designed mainly to address the main hormone systems that are involved in hair loss and the progression of it, and assessing if you are not just a good candidate for intervention, but also your likelihood of encountering side effects during the perpetual use of that treatment. Because unfortunately, androgenic alopecia, as implied in the name, androgen, it is dictated by androgens ultimately, all but there's a variety of downstream consequences of the activity of those androgens. Ultimately, the manifestation of hair loss in males is androgen derived. And this is why, in general, men have hair loss almost across the board. As they get older, it's like pretty unlikely that you won't be affected in some capacity, whereas with women, it is far less prevalent. Now, they have their own issues with hair loss, but it is not necessarily dictated entirely by androgens, and it's more in postmenopause. Now, with men, the most effective way to stop hair loss in its tracks, as you would probably infer by me talking about, okay, well, what's the difference between men and women here, and what is the main thing that's determining hair loss? Androgens. What is like the logical conclusion as to what would stop it? Unfortunately, it is inhibiting androgens. There's hordes of literature that reinforce this. It's almost beyond question at this point that this is the primary thing that determines hair loss, all but even if it's indirectly the primary root of the issue, unfortunately, is DHT. So manipulating that is not side effect free in every single individual, and assessing if you are that person who might otherwise encounter side effects or gynecomastia development or erectile dysfunction. Like, there are certain things that you could kind of flesh out the probability to some degree via a panel that is designed around this assessment of your exact health status right now before therapy as to if you're a good candidate. Because some people do encounter lowered libido, erectile dysfunction, depression. Like, this is not impossible to happen, all but I do think ultimately getting a sense of where you stand on your ratio of androgens to estrogens, binding proteins in the body, and a lot of the same stuff we do test with our other panels, but with a greater emphasis on the hormones that dictate free androgenic signaling, in particular DHT action through total DHT, free DHT levels, getting a sense of where you stand in your propensity to develop, breast tissue as a male is of a greater emphasis, and to assess that you don't have any neurosteroid deficits prior to starting therapy, because there is also impairment of the synthesis of certain calming, anxiety reducing neurosteroids that may otherwise be somewhat inhibited, all but not clearly in the literature, but may be inhibited to some degree by the implementation of something like Finasteride. So assessing where you stand on the spectrum of, are you a low producer at baseline and then you're pushing yourself into a state of deficiency with this therapy introduction? Are you somebody that has borderline low T to begin with, and when you drop your DHT and now you're relying almost entirely on the minimal testosterone you had to begin with to support all androgen induced functions in the body? These are all things that could be used as factors to determine how good of a candidate are you, not just for the efficacy of the treatment, but also the propensity for side effects. Certain individuals, if you have enough testosterone working in your body to offset the decrease in DHT, at some level you will have enough testosterone to offset the androgenic input that otherwise was facilitated through DHT, even if you deprived it entirely. But depending on the person, that level may exceed your natural capacity for what you need specifically. Or you might have a disproportionate amount of estrogen relative to your androgen input, or high SHBG. When you decrease your DHT, this becomes an unfavorable balance of androgen to estrogen. That's where the gynecomastia and erectile problems come in, or depression, or lack of motivation and drive. The masculine traits that you otherwise associate with male hormones can be diminished to some extent if you're not in a favorable baseline state to implement these therapies and be one of the individuals who gets away scot-free, more or less seemingly, with minimal or imperceivable entirely, aka zero side effects, and the full benefits of the treatment. You want to know full blown, before you get into it, what is my likelihood of this happening? You can't say with certainty, even with the blood work, but it's better than nothing in my opinion.
If someone's in their 20s or 25 years old, hair is important to them. They want to hold on to it as long as they can. You already mentioned you're prone to what you're prone to. You're going to lose it eventually. It just kind of depends on basically just when it's going to happen. When would you recommend someone actually getting, testing, looking at their levels to see when it's appropriate time to jump in to explore these
I would say
options?
after fully going through puberty, if you are very prone to hair loss, that is probably the earliest time I would recommend looking at it, because it's tough, man, because it's like, even when you look at the side effect potential, does it outweigh the mental burden that it has for some people from a cosmetic perspective? Some people actually do not even want to leave the house because their hair loss is bothering them that much. And, some people might say, just shave it, bro, be confident. Jason Statham, he's great. The Rock, Bruce Willis, the standard examples that everyone thinks of. And that works for some people.
Sure.
Some people it doesn't work so well. So, to tell that guy he just needs to be happy with being bald because you are, like, don't impose that on him. Like, that's his decision at the end of the day. And similarly, guys with hair who prevent hair loss shouldn't be imposing their decisions on people who are trying to decide if they want to use drugs or not. Anyways, as far as the earliest age, I would say once you're done puberty, that's kind of the earliest I would look at it seriously. I don't even know for sure that you would be inhibiting your growth capacity should you have intervened mid-puberty, but I certainly wouldn't want to. Like, that is a situation where I would say, okay, you're probably maybe let some hair go to ensure that you're getting the full effects of your DHT when you need it to achieve full maturation, masculinization of the things you need to be masculinized. You don't want to end up with like a higher voice or a smaller penis because you started finasteride a bit earlier. Not that I know it would, but I mean, like, who wants to chance that?
So people should start off by getting the comprehensive hair panel that covers all of the hormones. And
although I certainly wouldn't say it's a mandatory necessity, because some people are on a budget, they don't want to get elaborate blood work, they just want to jump on therapy. They also don't want to wait because it's not like you're going to lose your scalp while you're waiting for your blood work results. But I mean, some people don't want to coordinate the LabCorp appointment, wait a couple of weeks, and I would understand if they just want to, I'm pretty confident I'm going to be fine, I'm not too worried about the side effects, let me just get on therapy. Those individuals, that's their choice at the end of the day. But in general, if you were somebody who's kind of on the fence, I would say it's probably worth doing, because if you care that much about your health anyways and the potential side effects, you probably would benefit from a baseline panel for your actual seeing what's under the hood regardless, let alone your propensity to side effects from hair loss prevention medication. So seeing where you stand systemically as a whole, I think is worthwhile, but then getting that additional assurance that either I am a good or a bad candidate could help you guide your decision, make you feel a bit more comfortable with the process and even know where you stand. If you want to get a panel or get assessed by a medical provider who understands all of the intricacies of what we just discussed, check out marekhealth.com, and we have other content as well if you want to check it out on our social media platforms or the More Plates, More Dates YouTube channel. If you want to sort the playlist by hair loss prevention, you can check that out as well. So thanks for your time, man.
awesome. Thank you.
Awesome.